I'm here to cover this. I don't know what's this about, but I'm gonna cover it. I'm going live now. You know what I mean? I'm going live.
It could be even more in states like New York, where the population is undocumented.
So what this is about?
In a city and state where many industries do run on the backs of the labor of these community
So how long this start? What time to start about? Because I'm kind of late.
Oh, it started a couple minutes ago.
Address
Thank you.
immediately. New York can join the growing list of states that provide health insurance coverage to all residents regardless of immigration status. As an interim step, our state could expand emergency Medicaid to cover the cost of kidney and other organ transplants, including follow-up care. City and state decision makers can mandate education on health insurance options for undocumented immigrants for all of their hospital staff, in particular at the specialized transplant centers in our city and state. Funding for coordinators who are trained to support immigrants and Medicaid recipients in navigating the transplant process could be made available across the city. These are but a few options that could be immediately implemented to save the lives of the community members who continue to be the backbone of our city. We believe that healthcare is a human right. Thank you. Yes, it is.
Thank you so much. So next, we're very pleased to welcome a longtime champion for health justice in our city and in our state, the chair of the Senate Health Committee, a prime sponsor of both Coverage for All and transplant equity legislation. Thank you so much, Senator Gustavo Rivera. Buenas tardes. So let's start with some facts. Undocumented New Yorkers, number one, are New Yorkers. Number one. Empecemos con hechos. Las personas indocumentadas que son neoyorquinas son neoyorquinos y neoyorquinas. Number two, they're not only our brothers, our sisters, our neighbors, the folks who drive our cabs, who cook our food, who make our city run, but they're New Yorkers. I repeat again. No solamente son los que cocinan nuestra comida, guían nuestros taxis, hacen que nuestra ciudad funcione, sino que también son neoyorquinos. And they are human. Y son seres humanos. And what happens to human beings? They get sick. ¿Qué le pasa a los seres humanos? Se ponen enfermos y necesitan cobertura de salud. And they need health coverage. So just because someone is an undocumented person, an undocumented New Yorker, does not mean that they do not need care. And also, on top of that, there are many undocumented New Yorkers who not only need care, but need specific type of care, need kidney care. No solamente algunos de estas personas se enferman, sino que también estos neoyorquinos a veces necesitan riñones. Y la realidad que en este momento lo que está ocurriendo es que en este estado no tratamos a las personas indocumentadas, que son seres humanos, que se enferman, que necesitan riñones, no los tratamos iguales a las otras personas. So at this moment, New Yorkers who get sick, who need kidney care, who need health care, period, are not treated in the same. But we can solve that. So I am speaking directly to our governor. Yo quiero hablarle directamente a nuestra gobernadora. We missed an opportunity, Madam Governor. Perdimos una oportunidad, señora gobernadora. Durante el presupuesto, during the budget, we missed an opportunity. We could have put coverage for all in the budget. Pudiéramos poner cobertura por todos en el presupuesto. No lo hicimos. But you know what, Madam Governor? We can still get it right. Before the end of this legislative session, not only can we get coverage for all, and while seeking a federal waiver could get over $400 million in savings for the state, but provide health care for over 240,000 New Yorkers. No solamente pudiéramos nosotros ir al gobierno federal y pedirle permiso para poder darle cobertura a estas personas, sino que ahorraríamos más de $400 millones para el estado de Nueva York. Y lo podemos hacer antes de que se acabe esta sesión legislativa. And we can also pass my bill, which would, because as was mentioned earlier, undocumented New Yorkers right now can actually be not the receivers of a transplant, but can actually give a kidney to someone else. What kind of unfairness is that? En este momento, una persona que está indocumentada puede dar un riñón, pero no puede recibirlo. Y esto hay que cambiarlo. So, I stand together with all of my colleagues here as well as my colleagues up in Albany, but I say once again to you, Madam Governor, we didn't get it right during the budget, but that's okay. We can still get this right. We can still provide hundreds of millions of dollars for the state, provide health care to hundreds of thousands of New Yorkers, and above all, remember that part. These humans are New Yorkers regardless of their immigration status, and we can take care of them. If you get it right, we can get it right together with everybody. All right? Let's get it done. Thank you so much, Senator. Next up, we have an absolute champion for health justice, a champion for her district, and also a prime sponsor of the Coverage for All legislation that we need to pass at the state level, Assemblymember Jessica Gonzalez-Rojas.
Good morning, everyone. I am so proud to be here alongside advocates who have stood with us every step of the way as we fought for health justice in this budget. And as my Senate colleague has said, el luchador, Senator Rivera, we have an opportunity right now. While we were unable to get this in the state budget, we were able to pass Coverage for All through the Health Committee in the Assembly and the Health Committee in the Senate. We are one step closer to ensuring that 245,000 New Yorkers without immigration status can get the health care that they need. And let's remember, we're paying $544 million in emergency Medicaid. These human beings, these neighbors, these New Yorkers, these folks that have kept the city and state going during the pandemic and continues to be the backbone of the city and state are ineligible for care. But when there is an emergency, we are here to cover it. But that's not okay, because that is not healthy. That is not just. And that is not cost efficient. We have an opportunity to work with the federal government to submit something called a 1332 waiver. We will be able to use federal dollars, save the state money, use federal dollars to ensure that all our New Yorkers are covered with our essential plan. We are on the precipice of this fight. And as was mentioned, as a state, we are fighting like hell for our undocumented New Yorkers to make sure that they can live, work, and thrive in this state. And several years ago, we were able to pass the Green Light Law, which allows our undocumented New Yorkers a license. And when you sign up for your license to drive, you have this little checkbox. Can you be an organ donor? Can you save lives? And countless of our undocumented New Yorkers have checked that box. So they can give an organ, they can give a kidney, but they cannot receive. Is that right? No. That ain't right. So while we are fighting for Coverage for All, actually we're fighting for the New York Health Act, which is the gold standard, but we need Coverage for All. But in the meantime, we have countless New Yorkers without immigration status who are waiting for a kidney, who need that life-saving care, whose members of their communities have been willing to donate, but they cannot receive. And that is not right, and that is not just. So I'm so proud to not just carry Coverage for All in the New York State Assembly alongside my colleague, but also carry the bill that would allow for our Medicaid program, emergency Medicaid program, to cover kidney transplant. Because it is critical, it is life-saving, and we need that today. Thank you so much. Gracias a ustedes.
Thank you, Assembly Member. Next, we'd like to welcome a champion of our city's safety net healthcare system to talk about the connections to that, Council Member and Chair of the Hospitals Committee, Mercedes Narcisse.
Good afternoon, everyone. My name is Mercedes Narcisse. I represent the 46th District. As a chair of hospital committee here, in the city of New York, the city council, which is, when we're talking about New York City, we're talking about leading by example, because we're one of the biggest city, nicest city, the city that welcome everyone, the one that have the torch to say everyone welcome. So as a nurse for over 3 decades, you heard it from my colleagues in the state level. In the city level, I'm gonna say, as a nurse, it should not be who you are, where you came from, what color of your skin, what language you speak, to determine It should not be a determining factor to get a kidney. It should not be a determining factor to say you should get health care. We saw it during the height of the pandemic. The pandemic, COVID did not know the color of the skin to enter the house or the street, right? So I'm here to support, to say enough is enough. We are immigrants that come from all over. When you step here, you are New Yorkers, and you should be treated as New Yorkers. The immigrant that we're talking about, contributing so many dollars, billions of dollars. You heard it from my colleagues, and that's the truth. That's a fact. And not only that, during the height of the pandemic, when most of us was hiding, those are the immigrants that are taking off over the street to take care of us, to make sure they deliver our food, to make sure they stay in the hospital to do their work. So let's do the right thing. We need coverage for everyone. Like I said again, during the height of the pandemic, COVID did not know where it was going. Everyone was at risk. So therefore, it is our responsibility as government to make sure we govern, to make sure we give help to everyone. It should not determine by the color of your skin. Again, let's do the right thing, giving health care to everyone in our city. So when we do that, it is cost effective, and we don't have to. One more thing. We're talking about kidney. Dialysis should not be a way of doing business. No, it should not be. This is people's health. You heard that when we get our driving license, whenever we get it, we donate. Everyone is donating. So therefore, when you're on that list, it should be, I want to see the list. I want to say H&H, we want to see the list and who received kidney in our hospital. So I thank you. Continue fighting for health care for all, and that's the equity we're talking about. Thank you so much. God bless you.
Thank you. And next up, we want to welcome a member of Bake the Road New York, a founding organization, grassroots organization, driving this ongoing battle to cover every New Yorker, Juan Hurtado.
Gracias, buenas tardes, bienvenidos. ¿Qué queremos? Cobertura para todos. Aquí estamos y no nos vamos. Tengo el encargo, mi nombre es Vicente Mayorga, organizador. Tengo el encargo de dar el testimonio de mi amigo inmigrante Juan Hurtado. Hola, buenas tardes. Mi nombre es Juan Hurtado, soy inmigrante boliviano que vive en Manhattan y miembro de Make Road New York. He estado viviendo en Estados Unidos por más de 5 años. Vine aquí buscando una mejor calidad de vida como inmigrante. He trabajado en muchos tipos de trabajos, en construcción, limpieza, lo que sea que me proporcione ingresos para
Alright, cool. Thank you.
comunidad.
Alright, cool. Thank you.
Actualmente trabajo como cocinero en un restaurante, pero últimamente ha sido difícil porque el trabajo es a tiempo parcial. Como inmigrante, mi acceso a la atención médica es limitado porque no tengo seguro médico. El costo de la atención médica sin seguro es exorbitante. Solo tengo acceso a Medicaid de emergencia que me permite ser visto en caso de una emergencia. Sin embargo, esto no es suficiente. Merecemos tener pleno acceso a una atención médica de calidad. Tengo dolor en la pierna, la espalda. No estoy seguro si es relacionado al trabajo o a la edad, conectado con algo más serio. No he ido al médico porque no tengo seguro médico y no tengo suficiente dinero para pagar las facturas que vienen cuando alguien no tiene seguro. No es justo que nos excluyan. Nosotros también contribuimos a la economía del Estado a través de nuestros impuestos directos e indirectos. Nosotros también somos miembros de esta comunidad. Por eso todos debemos tener acceso a la salud, porque es un derecho humano. Demandamos cobertura para todos para poder tener mejor acceso a cuidado médico de calidad. Es vergonzoso que tengamos la dicha de donar un riñón o algún otro órgano, pero no tenemos derecho al cuidado médico. Y no tenemos acceso a un trasplante. Tenemos la oportunidad de hacer lo correcto y arreglar este problema. Pasar cobertura para todos y abrir la cobertura del plan esencial. Esto es en este año, para cobertura para todos. Tenemos la oportunidad de enmendar la excepción 1332 para pedirle dinero al gobierno federal para que no le cueste nada al Estado. ¡Sí se puede! ¡Sí se puede!
Thank you so much. I will be interpreting. Unfortunately, Juan was not feeling well, wasn't able to make it today. Hello, good afternoon. My name is Juan. I am a Bolivian immigrant living in Manhattan and a member of Make the Road New York. I have been living in the United States for over 5 years. I came here seeking a better quality of life for myself. As an immigrant here, I have worked many types of jobs. I have worked in construction, cleaning, pretty much anything that would provide me with an income to make ends meet. I am currently working as a cook in a restaurant, but I have been struggling lately because I am only working part-time. As an immigrant, my healthcare access is limited because I am uninsured. The cost of healthcare without insurance is exuberant. I have access to emergency Medicaid, which allows me to be seen only in cases of emergency. However, this is not enough. We deserve to have full access to quality healthcare. I have pain in my legs and in my back. I'm not sure if it's related to old age or connected to something more serious, and I haven't gone to a doctor because I don't have health insurance, and I do not have enough money to pay for the bills that come with being uninsured. It is not fair for us to be excluded. We too contribute to the state's economy through our taxes. We too are members of this community, and for this reason, we should all have access to health care because health care is a human right. Therefore, we demand that Coverage for All pass this session so that we can have better access to quality health care. Like myself, many of my friends have gotten sick and have been excluded from quality health care due to our immigration status. It's shameful that immigrants can donate kidneys and other organs, but it's nearly impossible for them to receive a transplant. Now we have a chance to do the right thing by passing Coverage for All, which would allow low-income New Yorkers to access the essential plan. This is the year for Coverage for All. We have the opportunity to amend the 1332 waiver and to request money from the federal government and have it cost the state $0 and also save the state money. What do we want? And when do we want it? Thank you.
Okay, now we want to welcome a representative of one of the most diverse communities and districts in the world, a champion of New Yorkers and immigrants' rights, member of the Committee on Immigration, I believe, Councilmember Krishan.
¿Hace Camino está presente? Sí. Nilpi está presente? Sí. Presente. Good afternoon, everyone. Buenas tardes. My name is Krishan. I'm the council member for Jackson Heights and Elmhurst, Queens, two of the most diverse immigrant communities in the world. And we are here because, plain and simple, we know two things. That one, healthcare is a human right. And two, our immigrant communities, our undocumented immigrants, are the beating heart of our city, our most essential workers. So it is fundamentally unfair and unjust that they do not have access to organ transplants. They don't have access to the same quality and level of healthcare and healthcare procedures as any other New Yorker in this city. And so we can't talk about healthcare as a human right. We can't support that if we are not taking care of our most essential and our most vulnerable communities. It begins here. And so I stand with my amazing organizations that Make the Road New York Lawyers to Public Interest, my state and city colleagues, calling on our government at the state level to get this done, because we are anxiously awaiting to make sure that actually healthcare is a human right in the city, and it starts with our immigrant communities and especially our undocumented communities. Brevemente en español, mi nombre es Krishan, soy el concejal de Jackson Heights y Elmhurst, Queens, y bueno, estamos acá porque sabemos nosotros dos cosas. Primeramente, la salud es un derecho humano. Y segundo, nuestras comunidades de inmigrantes, especialmente los que no tengan papeles ni estatus, son el corazón de nuestra ciudad, los trabajadores más esenciales. Así que es sumamente injusto y no podemos hablar de la salud como un derecho humano hasta que nosotros protejamos a nuestras comunidades de inmigrantes. Aseguremos que nuestras comunidades de inmigrantes tengan el mismo acceso a atención médica, el mismo nivel de cuidado, pues de procedimientos en los hospitales como cualquier otra comunidad. Entonces, estamos acá como una consejo municipal, con nuestros electos en el estado, para ponerle presión al gobierno del estado, porque tenemos que terminar con esta cosa. Tenemos que tomar en serio el principio de la salud es un derecho humano. Let's get this done. Muchísimas gracias. Okay, seguimos adelante.
Thank you, council member. We want to welcome now from the New York Immigration Coalition of dozens of organizations fighting for the rights of immigrants statewide, Melinda Elias from New York Immigration Coalition.
Thank you. I wanted to thank NYLPI and Make the Road New York for co-sponsoring the report for advancing kidney transplant justice for immigrant and low-income New Yorkers. NYLPI has been advocating for the importance of securing this necessary life-saving treatment since 2015. Healthcare is a human right that not all New Yorkers currently have access to. As we see with the report, many immigrant New Yorkers with end-stage renal disease are relegated to long-term dialysis treatments, which are more costly and debilitating. They say it takes a village to raise a child. Well, undocumented immigrants are the lifeblood of the village that raises New York City children. From delivery folks to housekeepers to childcare workers and beyond. These New Yorkers are hardcore. They do the job when no one else will. They can be counted on, and they are part and parcel of a diverse, vibrant New York City family, and we owe them life-saving health care at the very best. It's a violation of the Golden Rule and our civic responsibility to our fellow man to not advance kidney transplant justice for immigrant and low-income New Yorkers. We must right this wrong and pay back the community that raised ours. An NYIC member from the Upper Hudson Valley once expressed her fear of her father visiting doctors now that he is getting older. He is still undocumented, even though they have been going through the process to get him naturalized for many years. As a former detainee, our member is afraid of the rising cost of medical care that her father desperately needs. He's worked in the recycling industry for more than 20 years after immigrating from Haiti. At the NYIC, we value our communities being healthy and safe and the contribution that immigrant New Yorkers give to the city. That's why we believe in passing the Coverage for All bill to make all low-income New Yorkers eligible for the state's essential plan, regardless of immigration status. Immigrants make up 54% of essential workers in New York and 70% of New York's undocumented labor workforce in essential businesses that have helped sustain our communities during the pandemic. I urge everyone to contact their legislators and demand the passage of the Coverage for All bill so that our communities can live a healthy and dignified life. As an intermediate step, NYSC also strongly supports passage of A6735S3577 to ensure that all New Yorkers who have undergone dialysis for at least 2 years receive equitable access to life-saving transplant care. Thank you.
Thank you. And finally, we want to hear from Carrie Tracy of the Community Service Society, who let us know how this all pays for itself.
Thank you. Thank you for inviting me today. So I'm here to sum all of this up. It's so simple. Healthcare is a human right, and immigrant New Yorkers are human beings, and they have the same rights to healthcare as everyone else. And New York has an opportunity to make that right real by providing coverage to 240,000 immigrant New Yorkers who qualify for the essential plan except for their immigration status. So how is it complicated? Is it because it's going to cost New York a lot of money? No, it's free and it will save New York $500 million. It's a win for the state budget. It's a win for immigrants. It's a win for the safety net providers that serve our immigrant communities and all of our communities. And it's a win for justice, for healthcare as a human right. So we are here to say there's still time to pass Coverage for All and for the governor to sign it, to fix that waiver and to get coverage for all in New York. Thank you.
Thank you so much. Si se puede, yes we can. There's a lot we can do right now. So for members of the press, we appreciate you covering this. We want to remind you we have copies, both online and paper copies, of this new report in English and in Spanish. And we have a lot of folks impacted by this injustice and representing communities impacted by it that can take any questions now.
Yeah, I want to know, do you think that this is have to deal with because of the high risk of disease in certain countries, of the reason they can't receive? Like usually when you donate blood, they actually have been outside certain countries. And maybe is that the reason why you can't receive, or can you answer that?
Is the question, is the reason they can't receive because
They live out
risk of disease from other countries? No, the risk is, the reason is simple. People are excluded because they are undocumented and uninsured. It has nothing to do with their health status. They can't even get in the door to these hospitals to have their evaluations to determine if they're even eligible because of their immigration status. Sometimes even people who have insurance, who have the insurance that'll cover the organ transplants, will not be allowed to get their appointments because they lack a social security number, something that's completely unnecessary to be listed for an organ transplant. It has nothing to do with their health because they don't even get the opportunity to check their health.
So is that kind of illegal because of the HIPAA laws, or is it totally legal right now?
I'm not a lawyer.
Yeah.
But as far as we understand it, it doesn't even get to the point where we're talking about legality. It's really just about misunderstanding, bias, and systemic exclusion.
All right, cool.
Abogado, ¿usted puede explicar eso mismo en español?
Sí, no soy abogada.
Usted es Karina.
Soy Karina, sí.
Pero representa...
Represento a New York Lawyers for the Public Interest. Soy defensora de salud de New York Lawyers for the Public Interest y ayuda a los inmigrantes de esta ciudad a obtener su seguro médico y también para obtener los servicios que necesitan.
Bueno, ¿puede explicarme en español exactamente eso?
La pregunta que nos hicieron es por qué excluyen a las personas indocumentadas o de otros países de obtener su trasplante de riñón o de órganos. La pregunta fue porque a causas de razones médicas, y la razón es muy simple, es porque la exclusión tiene que ver con la falta de seguro y porque son personas indocumentadas e inmigrantes. No tienen ni la oportunidad de hacer su cita para ser evaluados, para determinar si son candidatos para el trasplante. Los excluyen los hospitales y nos excluye el sistema de salud de nuestro estado, y queremos cambiar eso.
¿Ustedes tienen un estimado de cuántos inmigrantes indocumentados no tienen acceso a servicios de salud y trasplante como consecuencia de esto?
Es difícil estimar, ¿verdad? Porque nuestras comunidades indocumentadas no quieren, pero tenemos como 2,000, sabemos que hay como 2,500, 2,500, disculpa.
Ustedes hablaron de un número en la convocatoria de 245,000.
245,000.
¿Me puede explicar de dónde
Sí,
es
el número, puedo llamar a otros miembros de la comunidad que saben los números un poco mejor.
Okay.
Pero si quieren hablar de las razones por la exclusión, muchas gracias.
¿Y el reporte qué es lo que dice? ¿Me puede explicar en español qué fue lo que ustedes encontraron en ese reporte?
Encontramos que gente que es indocumentada, que falta de seguro médico, es excluido de los sistemas de salud pública, o sea que no pueden obtener seguro médico que para su trasplante, aunque sí pueden recibir su diálisis por largo plazo. Sabemos que el diálisis a largo plazo tiene resultados malos para la salud. El tratamiento más seguro para una persona que necesita un riñón es el trasplante, y sin embargo estas comunidades no tienen la opción ni de ver a los doctores cuando tienen el seguro, y muchas veces cuando no tienen el seguro, y muchas veces hasta cuando tienen el seguro no tienen esa opción, porque los sistemas de salud, los hospitales especializados no lo reciben.
¿Usted piensa que muchos inmigrantes, cuando van a buscar su licencia de conducir, deberían seguir ofreciéndose como donantes, o esta es una situación que los pone entre la espada y la pared? No, le pregunto porque...
Sí, que sí deberían de seguir siendo donantes.
¿Usted cree que deberían seguir siendo donantes ante esta realidad?
Esa es una opción que tienen todos como individuos, ¿verdad? Es una opción altruística que la gente puede hacer para dar el regalo a la vida, y a veces lo dan para sus familiares también. Tener más órganos en la tasa de órganos disponible ayuda a todos. El problema es que ellos no pueden acceder a esos órganos porque están excluidos de nuestros sistemas.
¿Quiénes los excluyen? ¿Los hospitales o el mismo sistema de gobierno?
El sistema de gobierno no le da cobertura de seguro a la gente indocumentada. Tenemos opciones aquí que han escuchado de nuestros representantes aquí que pueden cubrirlos con Coverage for All y otros bills que se están pasando, pero también los sistemas de salud, en particular los sistemas de salud privados donde se hacen los trasplantes de órganos, no saben que la gente indocumentada sí puede tener seguro por medio de leyes de protocol, donde pueden obtener los Essential Plan y Medicaid del Estado.
Finalmente, usted sí sabe que personas indocumentadas han ido al hospital a buscar ayuda a un trasplante y le han dicho no porque usted no tiene seguro social o porque no tiene ningún tipo de documentación legal.
Desafortunadamente conocemos muchas historias así. En nuestro reporte tenemos 2 historias de unos de nuestros clientes que enfrentaron esa exclusión, pero todos mis clientes enfrentan eso todos los días. Llaman y ni le dan la cita. Lo primero que le preguntan, nombre, fecha de nacimiento y seguro social. Y si no tienen eso, ni la cita le toman, ni su información le toman, no pueden hacer sus citas. Gracias.
¿Su nombre completo, Karina?
Karina Alvistegui Abba.